Hi, this is Meghan McGovern again, and we are back together. We have a group together who've all had procedures done, and just kind of chat about it and talk about our experiences.
I was listening in on Mike and Robin, and I have to say that he mentioned that he told two close friends. I told everyone in my Rotary Club. So I figured they would know about it anyways. But I think in my case, I'm probably about 6 weeks out, and some longer duration. Yeah, and I can definitely see some amazing differences, and has really, in my case, this down here was what really bugged me the most. And you know, Mike, you mentioned that it was a opportunity for you to kind of feel younger.
Yeah.
And you do. You look at yourself and you look healthier. You feel healthier.
I think it's more healthier than looking younger. And you and I had talked about that a little bit. And when you feel healthier, and you know when you look in the mirror and you see yourself looking healthier, you're more confident. I mean, just walking around every day in the store or wherever you are. And you talked about that a little bit, how just healthier is confidence, and it feels great.
We were talking earlier, and the thing about the pain and how to deal with it. And for me, I'm not into Zen and all that stuff, but I took the position like going to the dentist, that I just had to kind of zero out my feelings and try to focus on it and try to deal with it. And for me, being able to do that really made this experience not real painful. And but it'd be not truthful to say it doesn't hurt at all. There is some pain with it, but like that expression, no pain, no gain.
Well, I mean, you helped me out when I went, because I heard that you took a break and found your spot. So I knew that going in, and I didn't have anesthesia or any of the things to help it, but I knew that going in. And Robin,
oh, he truly didn't even flinch, didn't move a muscle, and I was like, babe, can you feel this?
She wanted to make sure it was still working,
Yeah.
but I did.
Good job.
But I did, because
He was
of
like, "There's
talking
no
to you
way I'm
first,
gonna-"
I just found my focus and worked.
It's amazing how that works for men. I'm going to do better than that other guy. I'm not going to move at all. I was thinking just the same thing.
That's right.
But you, sorry.
I wasn't trying to
I know,
compete with
I
him.
was-
I just gained from that knowledge.
If you're jumping around and going, ooh, give me 5 minutes or whatever, it's going to take longer. Just try to get in, get out, and the professionals providing this treatment really know what they're doing, and they're cognizant of what you're feeling, and don't push too hard. But it's really an experience that I don't regret by any stretch of the imagination. It was fantastic.
I've heard about Meghan, though, that she's, from you and others, that she's a true artist,
Wow.
actually really puts a lot of effort into what's going to make you the best you can be, versus some other doctor that says, 6 milliliters or whatever it is, here and there, and you're done. I think you put a lot of effort into it and try to figure out what's best for them and what their goals are.
That's part of what brings me joy in doing this, is really creating what
right.
you are looking for and what you are looking for, and getting you what you're looking for.
And that's exactly what I tell people whenever I'm talking with them too. I talk to a lot of people that maybe haven't seen Dr. McGovern yet, or there for a facial or for some other treatment, and they're interested in things. They bring it up, they're a little curious, and I say, first of all, she's a woman, and she knows how we feel as women whenever I'm talking with a woman, and she's successful because she has passion for it. She really, and I think you do. I think that's why you're so successful at it, is women feel comfortable with you. They feel like you're taking the time to really find out what we want personally.
Yeah, I would like to add to that to me, what makes Dr. McGovern special is the fact that although her formal training and discipline is the use of a scalpel to help people with their bodies in all areas, yet as a physician and a surgeon, that's her training and expertise, and yet she can look at other alternatives that don't involve that expertise, don't require a scalpel, and recognizes that some of those can give equal or even better results and with less side effects, less downtime, less expense. And that to me is pretty impressive. I would guess that's kind of unique in your profession. You know, you watch the movies, the TV shows about plastic surgery and all that.
Not
and
all like the ones on
yeah,
TV.
they're not
Thank
all like
goodness.
that. But I think it's really important for people to understand that, and I know your book that you're working on is going to deal with that, and that's really pretty exciting. I think it gives people alternatives that they're just not aware are so significant, you
Right.
know, and beneficial. And I think that's
Because
really
it
great.
gives me comfort too, knowing, I don't know why, but I think that a normal doctor wants to jump to the scalpel. I get none of that
Right.
from.
Well, I can vouch for the fact that she's a very good surgeon, but I think that your compassion too towards the fact that everyone doesn't want to have surgery, and that for many different reasons, you know, affordability, you know, and just that might not be their thing. And I think that your compassion for that, and then the fact that you are so tremendously talented, you can look at somebody and say, okay, I mean, I know that when I sit down with you for filler or for whatever, I'm just comfortable with just whatever you think you need to do, just do it.
My job is to help you learn the options and help try to get inside your head and find what's going to make you the happiest. And for some people, it's a little bit of everything, and for some people, their budget or their comfort level is tiny little bits of, you know, little tiptoeing kind of stuff. And for some people, they want to do everything that we can do and keep them looking like a human being, keep them looking like themselves. So it's really people will choose different things, and it's really important to me for people to be involved in the discussion and not just say, well, find something and do it.
Yes.
Everybody has something that draws their eye in the mirror, something that really bugs them, and I can address every other thing, but if it's not the thing that draws their eye when they look in the mirror, then I haven't really done what's going to make them happy. So it's really important for people to be involved in that process, and I hand them a mirror and say, let's look together and figure out what's bugging you, and then let's talk about what are the best ways of fixing that and you know, anything else that we want to talk about.
Well, that's interesting. I just wondered, do you have a preference? If people come in and say, let's look at it together, or they come in and say, I want fillers, or does it not
Well,
really
I like
matter?
fillers, so I don't have a problem with someone saying I want fillers. But there's a lot of education. I don't, some people are like, I hate these lines, put a whole bunch of filler there. And if the lines are there because of volume changes that have happened somewhere else, if I put a bunch of filler there, then I'm going to make them look like a bulldog. I'm going to make them
Yes.
look very bottom heavy, and that's not what we want to accomplish.
Like you put them in there for me
right,
to lift
and
up
it's
here,
lifting
because
it
you were
all
telling
back
me
up,
about the
right.
structure of the face
Right.
and how it builds up and
Right.
everything. And I understood exactly what you were doing and why
And
you were doing it.
Some people love that education process, and some people really think that they know what they want. And I want people to really get what they're looking for and look their personal best. And I don't want to do something that isn't going to give them what they're really looking for. So for some people, it's more challenging to get that education across, and we have to tiptoe and kind of get there gradually over time. I love people who come in and say, I am your palate, do what you will. It's fabulous.
Contact Dr. Meghan McGovern at Coastal Empire Plastic Surgery today to learn more.